Hello students, Kiranjit here from AK Nursing Academy. Today we will discuss about the Glasgow Coma scale. Glasgow Coma scale is first developed by the Sir Graham and Bryant Janet in 1974. They both are the professor of neurology in the University of Glasgow, and they first developed it for assessing the patient's neurological conditions. Nowadays, we are also using this tool for assessing the level of consciousness of the patients. So we are including in these three components. We check three responses of the patients. The first is E, second is V, the third is M. E stands for the eye opening, V stands for the verbal response, and M stands for the motor response. So in this, we are counting the scores for according to the patient conditions. It indication for some patients like patients who are intubated, who are in coma, patient admitted in our hospital. Then we check GCS of the patient to check the patient's condition, how is he is improving or his condition is deteriorating. So the first is eye opening. Eye opening, we are assessing these responses with some stimuli. In this included these trapeze pressure, supraorbital pressure, third is sternal rub, the fourth one is nail bud pressure. So here is two stimuli, central and peripheral. So we use the stimuli for assessing the patient response. Okay. So if we can say patient is responding to these stimuli, according to that we can check patient's scores and we count the scores and we assess what is the level of consciousness of this patient. Okay. Then trapeze response, central response, that is comes under the central response or central stimulus. So central response means patient's brain is responding for that. We check the patient's brain response. And the peripheral response, peripheral stimuli means patient's spinal cord is responding for that. So first is central stimuli. Central stimuli is trapeze stimuli. Trapeze pressure. We use our index finger and thumb and put pressure on patient's trapeze muscles. Okay. So its effect on the patient's activities. If patient try to fold, try to remove this pressure with this another hand, with this hand. So we can check and count the patient's score. So we will discuss this is in next point in the series. Okay, and the second one is the trapeze, and next is the or supraorbital pressure. We use our thumb, put here and put pressure gradually. So we check the patient's response, how patient responding to this pressure. The next one is sternal rub. So we make a fist and put pressure on patient's sternal. So we check the patient's response, how it's responding. Nowadays, it's very less useful, or we can say it's not used in nowadays because it makes bruising on the patient's chest. So it's more like we can say it's not useful and it's make problems for the patient. So the next one is we are using a pen. We're using a pen and put on the nail bud of the patient and put pressure here. So if you try on yourself, it's little bit discomfort for us. So obviously it's discomfort for the patient and patient responding for this pain. So comes on the Glasgow scale on these responses, how we scoring it. So first is eye opening. Eye opening means if nurse enter in the patient's room, no any kind of stimulus gives to the patient, Spontaneously, patient just open his eyes to check who is comes in the room. Then we give that patient score 4. Means patient is open his eyes spontaneously, suddenly, not any kind of response stimuli we are using for that. The next one is sound. If we make any kind of sound, if we talk with the patient, we call to the patient with his name and patient open his eyes, then we can say patient getting score 3. The next is pressure. Patient is responding to pressure. We talked earlier for that pressures, you know, trapeze pressure, chest rubbing, and or supraorbital pressure. If we use that pressures and patient responding to that pressure only, not any kind of sign, no, not any kind of stimulus, he is not responding, just only responding for the pressure. Then we give that patient only 2 scores and none. If we give that patient none, 1 score means patient is not responding for any kind of pressure, not responding for any stimuli. So this is not testable means patient have any kind of injury on the eyes, any kind of swelling, severe swelling we can say. So it's we can give that patient only 1 score. Okay. So next is verbal response. One verbal response we are using for that we are using only 4 questions for that patient to check the conscious level of the patients. First is name of the patient. Second is date of the birth. Third is date and month of that time. Okay. The last one is location of the patient, where he is located at that time, at the present time. Okay. If we ask the patient these 4 questions and patient responding us accurately for these questions, then we give that patient 5 scores because patient is fully oriented, patient is fully conscious, then we give that patient 5 scores. Next is confused. We ask the same questions, patient is not responding properly, patient is little bit confused, patient is alternate the answers, then we give that patient 4 scores. Next one is words. We ask the same questions, but patient is not responding accurately. He is using only single word, but that is not related with our questions. So we can say the patient is using inappropriate words for our answers. So we give only that patient three, 3 scores. So sounds. We ask the questions, patient just make incomprehensive sounds. Not any word. He is not talking. He is just making sounds. Then we give that patient only 2 scores. And last one is score 1. That patient is not testable because patient is intubated, maybe patient is in coma, so he cannot respond for our questions. So we give that patient only 1 score. Okay. Now next comes to the motor response. What is the motor response? Patient's extremities, how these extremities responding. Patient's hands, patient's legs, how responding for the stimulus. So here is a 6 scores. 6 points comes under the motor response. The first is if patient getting 6 score means he is following our instructions. If you tell the patient, if you ask the patient, open your mouth, take up your hand, make a fist, show me your tongue. If he following our instructions means he is obeying our commands. He is fully conscious. We give that patient 6 scores, right? The next one is localizing. That time we give only 5. If we give patient any pressure, he is responding for that. Means if we put pressure on the trapezius muscles, patient using his second hand, not the same hand, the second hand for removing this pressure. And this hand comes up to the clavicle bone. Then we can give that patient means he localize the pain. He knows where is the pain. He want to remove that pain. So we give that patient 5 score. Withdrawal. Withdrawal means patient want to remove his extremity from that painful area. That is a normal flexion, we can say. Means if we put trapezius pressure on that area, we put pressure on that trapezius muscle, patient using not the second hand, just only the same hand he is using, like this he comes here, but not up to the clavicle bone. So he just comes here. He cannot remove the pressure. He just comes here and stop. Means we can say it's normal. It's normal flexion. So we can give the patient score 4. Abnormal flexion. Abnormal flexion, we denoted it decorticoid. Decorticoid means this is our axis. This is our axis of the body, means center of our body. If we put pressure on the trapezius muscles, then patient using his hand, the same hand, not comes here. It's not come to uh, keep away the pressure. He just make a fist and decorticoid to axis of the body. So corticoids, COR means core of the body, center of the body. So we can say patients patients affected, brain is affected with head injury, with the brain injury. So he is not responding properly, right? So next one is extension. It we call decerebrate. Decerebrate means patient's body or extremities move away from axis. It's patient not making fist. Now he is opening his fist and folding his hand like this and go away from the axis. So we can say patient have extension, means it's worse position of this patient, means if patient is doing like this means patient is having severe problem. So we can give that patient only score 2. Here is one score if we are giving to patient means that patient is in coma, patient is paralyzed, so it's not testable for that patient. We just give that patient only one score because we know that patient is not moving, that patient is not responding to our stimuli. So if we check, we can assess these scores. There are 15 number of scores. Total score is 15, means the patient is fully conscious. If we can say patient GCS score is 13 to 15, that means patient have mild brain injury. It's affected on the brain injury, right? So if patient have 13 to 15, GCS score, patient have mild brain injury. If patient is getting 9 to 12 score, patient have moderate brain injury. If patient is getting 3 to 8 score, means patient have severe brain injury. Means patient is not responding for our stimuli. And if he is getting 8, means patient is intubated, patient have respiratory problem, he is not responding to our stimuli accurately. So thank you so much for watching this video, and if you want more videos then please follow my pages and follow AK Nursing Academy on Facebook, on Instagram. Thank you so much.